Hey everyone, and welcome back. My name is Tima, and today we were supposed to be starting our Intentional Inner Work series where we discuss self-esteem, self-worth, and self-perception. There's been a slight change of plans. Basically, I lied, and instead we're going to be extending our therapy series, specifically talking about the stigmas that exist within the therapeutic culture, as well as why those stigmas exist. The purpose of this video, as well as future videos to come, is to create a space where we can discuss mental health, human behavior, neurology, and of course, conflict analysis and resolution. Before we get into the video, I want to start by saying the content expressed is based on evidence-based research, historical research, and a little bit of opinion sprinkled in. So now that we got that out the way, let's go back. Let's start from the beginning. The research that was conducted several years ago describes human behavior, the way we interact with one another, as well as the way that we feel, which is incredible. But the stigma lies in the population and the limited demographic. If you've taken Psychology 101, you know that the pioneers of research came from a specific demographic. We already know the reason behind that. People of color were not allowed in those specific research spaces. Ultimately, that limited the population or demographic of those who could conduct research. So why is that harmful? With a diverse set of researchers comes a diverse set of data points. This is not to say that because the pioneers or those who laid the groundwork in research are typically all straight white males, that they all think the same. But what it does mean is that researchers who are women, people of color, and those who identify as non-binary within the gender spectrum are completely left out from conducting important groundbreaking research. We covered the fact that the majority of research experts came from a specific demographic and why that's harmful. But to add metaphorical fuel to the fire, those who were being researched on also came from a very specific demographic. That demographic being straight Caucasian males. So we have the majority of research being conducted by straight Caucasian males and the research being conducted on straight Caucasian males. And again, this is no hate to a specific demographic. We're just basing this information off historical context. So what happens to American society when only a specific demographic is doing the research as well as being researched? Simple answer, you get limited data points. And those limited data points are utilized to explain the behavior of several different cultures that have gone through different experiences, a multitude of different traumas, and a different way of understanding the world around them. This is where we get into misdiagnosis and stigma. When we consider why some specific demographics of people may be anti-therapy, it starts to make a little bit of sense when we recognize where therapy and its research practices came from. With some of the beginning approaches being so exclusionary and divisive, different genders, races, and cultures may be extremely apprehensive to be in therapy. Because I'm a Black woman, that is what I can speak on. The level of misdiagnosis within the Black community is astronomical. That's not to say that misdiagnosis doesn't happen to all demographics, and that's why I'm here. Not just here in this video talking to you, but here on the front lines as a therapist working to remove that stigma and to advocate for everyone who feels excluded from the mental health culture. I hear you, I see you, and I completely understand. Now that we've covered some of the historical context, let's move on to another reason why stigma exists within the mental health field. I'll just say it, some therapists suck. Some of us suck. We covered that in our last video as well, knowing when to fire a therapist. Because therapists are humans with flaws, there is a chance that you will be matched with a therapist who doesn't value the process, doesn't value your feelings, and doesn't meet your needs. If you need more information on how to fire a therapist, feel free to go back to that video. As therapists, we are also living in the system that you live in as well, going through our own struggles, our own drama, and our own trauma. While that is true and incredibly valid, we as therapists still make the commitment to non-benevolence, which just means to do no harm to our clients. So yes, we are struggling in the same system that you are, but it's our job to advocate for ourselves and to seek the proper resources. Therapists need a space to conceptualize the information that we're receiving, as well as to fill our cup so that we can pour onto others, specifically our clients. The mental health profession is not the only one that has issues. Like, let's be real here. I know you've gone to your doctor, worried, a little anxious, maybe writing down notes of the symptoms that you've gone through, just for you to go in that room and for them to tell you, maybe you should drink a little more water. Maybe you should get some rest. No, I don't think that's what it is. I know you've done research, but maybe it's all in your head. Don't tell me you haven't gone through that, because the majority of us all have. There are some that may not be as helpful, but that doesn't mean the entire field is problematic. There are bad apples in every field that you go into. So yes, some therapists suck, and that's because some people suck. People suck. It's just the reality that we live in. If that is your experience, that's completely valid, and I feel for you. But it's your job to either fire them or to move on from the therapeutic process completely. As I mentioned in our last video, there are several ways to heal. Therapy is just one approach, one that I believe in, but I also believe in many other approaches towards healing as well. I wouldn't call this a stigma, but more like a misconception. A lot of people don't know what therapy is. And now that I think about it, we may make another video on what therapy actually is. I say this because there is limited representation and education on the therapeutic process. The majority of the information and education that we get comes from media. I know you've seen the movies where it cuts to the scene and the main character is in therapy, laying on the long couch, and you see the therapist next to them, paying attention a little bit, but really just writing notes and judging them. Like, yes, it's funny, but the issue is that there's no other representation of therapy. So that's how people either joke about it or truly think the process goes. And I'm here to tell you that if you're a good therapist, it is nothing like that. The process does not work that way at all. Therapy is a multi-dynamic, compound exercise in understanding self, the way we perceive the world, and improving as a whole. And that looks different for everyone. That leads us into our next misconception about therapy. It's typical for clients to come into the therapeutic process asking how long healing will take. Unfortunately, there is no timeline on the healing process, and that's what makes it so difficult. What may take a client a few sessions to uncover may take another client years to overcome. And that's okay. There's never any shame in the process of healing. When we get into our next topic of stigma, this long process and no timeline wouldn't be that big of a deal if therapy wasn't so expensive. You could be paying anywhere from around $20 to $250 for one session. When you consider there's no timeline on this process, there's no telling how much you may be paying. As we discussed in our last video, therapy is an investment on yourself. But if you're not willing to invest a boatload of money, that's okay. And it's incredibly valid. So is therapy a scam? As a therapist, I would say no, but I think there's nuance within this question. I would say that in a lot of cases, therapy is a privilege. So it's important that you ask yourself, how much am I willing to budget for my healing? What are the boundaries that I am willing to assert to ensure that I'm not wasting my time or money? Let's move on to toxic therapy culture within our society. Let me start by saying we have come a long way in removing the stigma in receiving therapy. Back in the day, you were seen as weak or crazy for getting therapy. Now, the perception of therapy is shifting into self-advocacy, which is beautiful. But when considering the duality of that beauty existing, there's also some toxicity. How far is too far? I know you see it nowadays. There are people out here that will confidently say that if you disagree with them or if you hurt their feelings, that you are a narcissist. If I could remove a word from the human vocabulary, it would be narcissist. The misinterpretation of that diagnosis, as well as the misuse of the word in general, is sickening. Along with that, we get into self-diagnosis. Let me provide some nuance here. I am a firm believer that self-diagnosis in specific contexts is incredibly valid. As a person-centered therapist, I believe that people are the masters of their own life. That just means that people know their stuff. They know their behavior and they know how certain things make them feel. If you have taken time to deeply analyze yourself, your behavior, and your emotions, as well as doing research on specific diagnosis, I respect that. We already went into the stigma of receiving a diagnosis, specifically misdiagnosis. I have seen within this field people severely struggling, actually being on the spectrum and being told by medical professionals that it's all in their head. That is maddening. So if you do self-diagnose, okay. But the issue comes when you use that diagnosis as a reason for why you're being problematic and causing harm to other people. It's all about finding the balance in giving yourself grace and holding yourself accountable. Being mindful of intent versus impact. You may not be intending to cause harm, and a part of that harm could be caused by a diagnosis. But the impact is what you must take accountability for. We'll get into the specifics of this in a later video. Then we get into boundary setting. As I stated in our last video, setting a boundary is not supposed to be a threat, nor is it supposed to be a means to control the people around you. A boundary is established to give people clear details on how to treat you, how to respect you as well. So I won't name drop. Not like it would matter anyways, I'm just a regular schmegular person making a video. There are people asserting certain levels of manipulation and control, saying what people can and can't do with their own bodies, and passing it off as a boundary. This is harmful. Of course, we will get deeper into how to set a proper boundary, as well as how to decipher if a boundary is harmful or helpful. So stay tuned for that. America is divided in a multitude of ways. We know this. There's also parts of America that are incredibly inclusive, so I'm not here to hate on America. But one specific factor that is incredibly divisive, the concept of being triggered and overly sensitive. What I see most is the divisive nature being us versus them, specifically an older generation and a younger generation. So why does this exist? Rub some dirt on it and move on is what the majority of us were told as we were growing up. Along with that, we were either directly or indirectly taught to push our emotions down and keep it moving. Push forward beyond all means. This created a level of strength within us. I say that to say that it's not all bad. But what happens when the younger generation has taken time to assess how some of those narratives of push it down and move forward negatively impact our mental health? As we know, mental health awareness wasn't even a thing back then, especially for specific demographics and cultures. The younger generation has a different approach towards handling conflict. Being within an older generation, it can feel like a personal attack as well as straight ignorance whenever we hear someone who's younger call us certain names or toxic in our behavior and our approaches towards life. And I think that's because a lot of the approaches that we've taken, they've worked. A lot of us are incredibly successful and we have overcome what we may perceive the younger generation could never go through. I'm not saying that's my specific opinion, but I think being in an older generation and hearing stories and certain narratives be pushed that the younger generation just doesn't get it. So now we have both sides pointing out each other's faults, their weaknesses, specifically being triggered, too emotional, and on the other side, having no emotional awareness and limited ability to regulate their emotions. The them versus us conflict approach is not exclusive within this context. It existed before and it will exist far after. So how do we find the balance in honoring the toughness and the grit of the older generation and the sensitivity and awareness of the younger generation. Sprinkling in my opinion, I think it comes from providing grace to ourselves as well as humbling ourselves on both sides. As humans, we operate from ego and we have a tendency to always think that we are right. We'll cover ego and the function of ego in a future video. If all sides take time to analyze what did and didn't work for them, they can then create space to implement different tools and approaches towards improvement and balance. So really it's just about staying confident in what has worked for you and being willing to hear the other side and what has worked for them. That's easier said than done. Multi-dimensional change takes a long time to implement. Humans are set in their ways, not a specific group of people, but humans. There are subconscious factors as well as behavioral patterns that as a culture take a great deal of time to shift. I say all of that to say this. We have to be patient with ourselves, patient with society, patient with different cultures and different ways of thinking. This is the first time in America where we have a space to discuss our emotions, let alone understanding how our emotions impact our behavior. So we're still on a learning curve. We're understanding ourselves in real time in a way that we never understood before. This shift may not even occur within our lifetime, but how cool is it that we are a part of the process? What would it look like to reframe our perception of what's currently going on? Shifting away from demonizing being triggered, overly emotional, as well as having low emotional awareness, and shifting into understanding that this process takes time, giving ourselves grace, allowing ourselves to make mistakes, which we'll get into whenever we start the Intentional Inner Work series. Also allowing the people around us to make mistakes, not judging them so deeply, not excluding them or condemning them for thinking differently based off of their experience. Imagine a world where we operated from the narrative that people make mistakes and they're still worthy of acceptance. Now, that may be a long time coming. It may never happen, but it starts with understanding self and working to understand others and the world around you. So we're all done for today. I'm so proud of you. We've discussed stigmas within the mental health field, as well as harmful narratives. We've sprinkled in a couple opinions and even some approaches towards analyzing and understanding. I'm still debating on if we're going to extend the therapy series further and discuss what therapy really is, or if we'll move on and get into our Intentional Inner Work series. I appreciate you all for taking time to watch. Take care of yourself. See you later.